Let's shift a bit. I had a question in there about trainees, but I think we maybe already touched on that. Let's talk about some wins or successes in your institutions. I'm curious to hear what you're most proud of in terms of what you've been accomplishing or what you've accomplished maybe over this past year. And let's start with Dr. Trivedi.
Well, thank you. I think when I think about what we've been able to do, I guess I'm proud of the amazing team that we have at Shepherd, many of whom are on this call. And I just think about, I'll just say, victories and successes in a series of different places. I think about our child psychiatrists and specifically what we've been able to do to increase access to what they provide and their ability to see kids both in our special education schools, but also through consortium funding and what we're doing in local public schools across the state. And that, as I mentioned, is about 400 of those schools. And that's things that we've developed in just the last couple of years. I think about we had a ribbon cutting just in downtown Towson a couple of months ago, where we did exactly what Jill was talking about in terms of adding crisis bed services. And we worked with a local landlord who had I'll just say, a office building that he was not able to lease out, and convinced him to convert that into 26 apartments where 41 beds were created specifically for crisis bed services, and kind of making sure people had access and could avoid trips to the emergency room or inpatient stays as part of that process. I think about the work that we're doing in Howard County, and specifically uh, there we're building a residential crisis service right on the campus of our brand new hospital there, and expanding in that geography as well. I think about things that we're doing outside the state. So right now we are building a 150-bed psychiatric hospital in Raleigh, North Carolina with WakeMed,
Hmm.
85-bed hospital with University of Michigan in Lansing, and really figuring out how to provide uh, Maryland quality psychiatry to communities all over the nation. And I think as we do these things, it's really about how do we make sure that access is there. And then I will also say, kind of do that in a way where we're helping to elevate the quality of the care that's provided in communities across the nation. And those are all things we're incredibly proud of. And I will also just say, partnering with folks like Elias, kind of thinking about how can we work together. And we've been working really well with MedStar, and kind of what does that mean and what do we do? But also looking at how do we kind of expand what we can do by doing more together and in ways that are complementary for the people that need access to that care.
It was a perfect transition, Dr. Shaya.
Well, to our point, I mean, we are blessed in psychiatry. We have an opportunity for partnership. We have an opportunity for collaboration rather than competition. It is much easier for our population for us to work together. No one system can do it all, and we all together can do it better. And so, thank you for the collaboration. Thank you for pointing that out, Harsh. Indeed, it's been a pleasure. I think one of the greatest successes that I'm really proud and overjoyed for is that we now have a residency program in MedStar Baltimore. It's a very small one, just 4 residents, but we got our first class, and we have 4 great residents. We are now interviewing for our second class, and we are really thrilled with that. That is one way for us to help improve access and improve our pipeline, if you will. Another way to address the deficits that we have seen is we don't have enough psychiatrists to do everything that needs to be done. So we are really happy that in MedStar we have been able to implement the collaborative care model that's very well established across the nation and data to support its value. We have established it in more than 50 sites in MedStar, whereby our primary care doctors provide the primary care psychiatric services and our psychiatrists support them in the care that they provide. Another milestone win was the AOT bill that passed in 2024. After 20 years of trying and failing, it passed this time with a convergent coalition and strong support from MPS representation. Dr. Sarah Van Remen from the University of Maryland took the initiative to help us form a great team that created a convergence of representation for MPS, as well as our respective health systems, with Dr. Cynthia Major Lewis for Hopkins, Dr. Rishi Gautam for LifeBridge, and myself for MedStar Health. The team provided testimony and advocacy that were instrumental to the passing of the AOT bill. Another area that I'm really thrilled to be a part of, and like Harsh said, we have a wonderful team of emergency medicine doctors and hospitalists who have been great partners in this, and that is in reversing the cycle of opioid addiction, implementing buprenorphine initiation for both withdrawal and maintenance in our ERs and in our hospitals, and having now grown our team of peer recovery coaches for that initiative to about 50, 55 individuals across the system to support that initiative. Maybe the last thing I'll mention is not the least, but we conveniently call it the best, and that is Behavioral Emergency Services Transformation. And in that, we have been trying to optimize our crisis intervention services and our transfer and admission services, and also collaborating with a great team here from Hopkins, University of Maryland, as well as LifeBridge, and obviously with our Shepherd Pratt partners to improve our services in that area. It's been a great journey. Thank you.
Dr. Rockbasil?
Let's see. So when I think of what we're so proud of, it falls under education, clinical work, and research. So clinical work, we've really focused on access to care, like I think most people are mentioning. We have expanded our geriatric services and really working on a dementia program. You know, neurologists love to diagnose dementia. We do that too, right? But then when it comes to managing the behaviors, they depart from us. So we're expanding our geriatric cognitive program. So we're really excited about that. I mentioned the substance use disorders expansion in Baltimore, but also across the Maryland legal system. We stood up an advanced depression treatment program where the goal is to get people access, those that need it the most. So you can get TMS, you can get esketamine, you can get, if you have Medicaid, if you have Medicare, it doesn't matter what you have. We have figured out a way to get reimbursed for all of this. And it's really very exciting. We've opened up another, an adolescent IOP for after school, which is desperately needed when you're reintegrating kids from acute care back into the community. And we've expanded the support of young families and children with developmental disorders through a Healthy Steps program in our pediatric programs. So that's the clinical side. That's part of it anyway, when it comes to mind. In education, we do have 5 fellowships and the second or third largest adult training program in the country. We would like to expand to another fellowship in geriatrics, but we'd also are working on standing up the first national sports psychiatry, sports psychology program. So we're working on that. We're really excited by that. And in research, we have the Maryland Psychiatric Research Center, many of you may be aware of, and under Dee Kelly's directorship, she's amazing, and she's we're working on a nutritional treatment center for psychosis, and it's super exciting, and we've got some funders for it. So that's kind of what we're doing, and we're proud of. Thank you.
Thanks. Yeah, Dr. Kelly's great. I got to work with her a bit last year regarding some of her work there. Feel free, folks, to start putting some questions in the chat if you want them asked while we continue to highlight some of the successes with our panelists. Dr. Potash.
Thanks. I'm impressed with what's going on at these these fellow institutions. A lot of great stuff. I'll just mention we've had this Johns Hopkins Psychiatry Guide, which is a digital guide accessible through the computer and through people's cell phones, which has been around for about 10 years. Um, it's sort of like a digital textbook of psychiatry through a Johns Hopkins lens, with a focus on certain aspects of our somewhat unique framework for the field. But we just updated it recently, and uh, we updated hundreds of sections of it with a big new module focused on clinical guidelines for psychedelic medicine. Uh, Now, of course, psychedelics are not yet FDA approved, but as most of you know, people are finding ways to use them. Anyway, there are a number of well, in a couple of states, it is legal, and then in many other places, the quasi-legal uses are happening. And so patients certainly come to us often wondering about options for psychedelics or wanting to deal with the experience of having gone through the use of psychedelics. So we have guidance there. And another thing we did with our Johns Hopkins Psychiatry Guide is add 47 modules meant for patient education. So the kind of thing that a psychiatrist could print out and hand to a patient to help them understand what it is we're trying to do. So that is, it's very handy. The fact that you can have it on your phone makes it awfully handy. Available on Apple and Android platforms. I will tell you that in the psychedelic arena, we do have a clinic that we opened up called the Post Psychedelic Difficulties Clinic, and this is meant to take care of patients who have used psychedelics and come away feeling like it's been disturbing or disruptive or problematic for them in some way. So a graduate of our training program, Azine Beckrad, is running that in conjunction with, she's a clinician and she's doing it in conjunction with David Yaden, who's one of the leading researchers in our Johns Hopkins Center for Psychedelic and Consciousness Research. We are very excited about the work of the Psychedelic Center. It's got about 85 people in it doing studies mostly of psilocybin, the active ingredient in magic mushroom, in a protocol that combines it with psychological support. And we've published several studies showing it's helpful in treating depression, but we're also using it experimentally to treat anorexia, OCD, cannabis use disorder, opiate use disorder, chronic low back pain with comorbid depression, alcohol use disorder with comorbid depression. And then we've also got PTSD studies going on as well. So there's a lot happening there. There's much more to say, but I'll leave it at that.
Thank you, Dr. Gautam.
I think one of the things that we're particularly excited about is growing our educational fabric again. Not so much for Life Pressure Sinai. It has always had a very strong root in training, but for us in psychiatry. So we partnered with the GW School of Medicine 3 years ago to establish a regional medical campus. And the first full class of 30 students is expected to start in April. And we've had year-on-year increase in the number of students applying for psychiatry residency. So that is something collectively as faculty we've come together in setting up and providing students at like top quality education. And another area of relatively new expansion, which is grant funded, that I'm particularly excited about is maternal or women's mental health. I think it's historically under researched, under blah, 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 in many different ways, things that we don't kind of think about. So we garnered a bunch of grant funding and utilized the collaborative care model to place mental health services, psychiatric services in OB practices across the system. And we've had institutional commitment to actually sustain the program once the grant funding goes out. One of my strategic priorities over the next sometime would be to grow that. So those two is what I leave that at for now.
Great, thank you.